So for this question, we have a multiple choice question about a patient's injury. So a 16-year-old female basketball player heard a pop in her left calf and severe pain while trying to stop during a drive at a local high school basketball game. Upon examination of the patient, you find a large lump just distal to the posterior knee. What is the most likely cause of the patient's pain and physical condition? So we will take a look at the answers down below here. A is actually the correct response to this question, Achilles tendon rupture. So in terms of the presentation, the popping sound was the tendon actually rupturing, and the examination finding that large lump in the posterior knee, just distal to the posterior knee, would actually be the gastrocnemius muscle. As the tendon ruptures, there's nothing holding it to the skeleton anymore, so it kind of coils up and bunches towards the origin of the muscle. So that is a common presentation with any type of tendon rupture. You would hear a popping sound, and the muscle in question would kind of ball up and form a lump, right? There'd be some type of discontinuation of that muscle. So that's why that response is correct. So let's take a look at why the other responses are not correct. So we have a tibial fracture, which obviously is a fracture of the tibial bone, which is on more the anterior leg. It's on the medial anterior leg, so not the posterior leg. Plus, fractures aren't usually hearing a popping sound. Plus, you'd be able to palpate a tibial fracture because it is quite superficial in terms of the bone, and the presentation would be completely different. So that is incorrect. A hamstring tear, even though a tear, you could hear a pop with a muscle tear, the hamstring is proximal to the knee and not distal, so that would change the physical symptoms or the physical findings of the patient. So that would be incorrect. And then we have D and E, which are two ligament tears of the knee, the anterior cruciate ligament and the medial collateral ligament, which are both common injuries, especially in female basketball players. But again, the popping sound isn't often heard with ligament tears. Plus, ligaments again hold bone to bone, right? So there wouldn't be any muscle damage or muscle tearing as in the presentation above. So those would both be incorrect.